routine emergency spirals into a medical impossibility, when a quiet hospital clinician performs a life-saving technique that does not exist in any known manual. No textbooks, no training records, no precedent. Within an hour, sealed government lines light up. Within a day, her past begins to surface. And by the time the truth is revealed, the question is no longer how she saved the patient, but why the Pentagon was already watching her. Before we begin the story, where are you watching from today? Drop it in the comments. I love seeing how far these stories travel. And if you're drawn to stories of silent heroes, unseen sacrifices, and justice that arrives without warning, please subscribe. Now the story. The patient should have been dead before the stretcher reached the trauma bay. His blood pressure collapsed in waves, his pulse slipping like sand through open fingers, his lungs filling faster than any ventilator could clear. The monitors told a story no one wanted to hear, a body shutting itself down, organ by organ, despite everything modern medicine knew how to do. The attending physician had already shaken his head once. Slowly, final. That was when she stepped forward. No raised voice, no announcement, just a calm request for silence, not spoken but felt. Her hands moved before permission was granted. Someone started to object. Someone else froze. No one stopped her. And in that suspended moment, where training ends and instinct begins, she placed her palms against the patient's rib cage and did something no one in the room recognized. Not CPR, not surgery, not anything with a name. The heart stuttered, then beat. Harder, a nurse whispered, barely breathing, "What is she doing?" No one answered. Because somewhere deep inside them, every person in that room felt it. They were witnessing something they had never been taught. She was not remarkable at first glance. No medals on her scrubs, no confidence that demanded space. Her posture was straight but unassuming, her movements precise without hurry. The kind of woman people overlooked in crowded rooms and passed in hallways without curiosity. Her name badge read Evelyn Rowe. Just another clinician on a long night shift. But her eyes carried something different, not panic, not fear, but the steady, weathered focus of someone who had seen bodies fail in far worse places than this hospital ever could. The room smelled of antiseptic and iron. Latex snapped softly as gloves were pulled tighter. Sweat gathered beneath surgical caps. The kind of tension that prickled the skin. And still, Evelyn did not rush. She adjusted the patient's angle by a fraction of an inch. Pressed along a specific intercostal space. Counted silently, not seconds, but something else. Something internal. Later, a resident would try to describe it as intuition. Later, a senior surgeon would call it reckless. But in that moment, the heart monitor surged back into rhythm. Not normal, but alive. The room exhaled together. Someone laughed, sharp and disbelieving. Someone else felt tears burn behind their eyes. The attending physician stared at the monitor, then at Evelyn. "What technique was that?" he asked quietly. Evelyn removed her gloves with care. Her hands were steady. "I don't know that it has a name," she said. That was the moment the hospital began making phone calls. Evelyn Rowe had learned long ago that survival did not always come from rules. She grew up near the edge of nowhere, a place where ambulances took too long and help arrived too late. Her mother, a nurse herself, taught her early how to stop bleeding with pressure and prayer, how to listen to breath patterns like they were stories, how to tell when pain was lying. But the real lessons came later. War has a smell that never leaves you. Burned fuel, dust, copper, fear soaked into canvas and skin. Evelyn had not gone overseas as a doctor. She had gone as a combat medical specialist, trained to stabilize the unstabilizable. She learned medicine where there were no clean floors, no bright lights, no backup teams waiting behind glass. She learned with bullets snapping the air and radios screaming conflicting orders. She learned watching people die because procedure was too slow. Her hands remembered rib fractures from blast waves, lungs crushed unevenly, hearts thrown out of rhythm by force no textbook acknowledged. She learned how pressure applied at the wrong moment could kill, and how applied at the right one could restart life. She learned when to break rules, and she learned what silence cost. On her third deployment, she lost a medic named Aaron, not to enemy fire, but to protocol. They waited for authorization to attempt an intervention that wasn't approved. By the time permission came, Aaron's eyes were already glass. That night, Evelyn pressed her hands against his chest anyway. Tried everything she knew, everything she wasn't supposed to. It didn't work. But she remembered the feel of his ribs, The resistance. The moment his heart faltered. And she promised herself something then, quietly, without ceremony. If I ever see that pattern again, I will not wait. When she came home, she carried no visible scars. Just a silence that stayed heavy in her chest. She studied medicine formally, passed exams, earned credentials, but she never forgot the lessons that never made it into books. By morning, the hospital administration was uneasy. Charts were reviewed. Footage replayed. The procedure Evelyn used was cross-referenced against every database available. Nothing matched. Risk management frowned. Legal whispered. Someone used the word liability like a threat. She deviated from protocol. One voice said, "She saved his life." Another replied. But saving a life was not always enough. Evelyn was called into a conference room that smelled of old coffee and polished wood. She sat with her hands folded, listening to questions that circled but never landed. Where did you learn this? Who taught you? Why wasn't this documented? She answered honestly, simply, I learned it where manuals don't survive, she said. Some nodded. Outside the room, the patient, a middle-aged man with no military history and no special status, was awake. Confused. Alive. His family cried into each other's shoulders. No one told them yet how close he'd come to dying. No one told them that what saved him technically should not exist. The call came at 11:47 a.m. Not from a medical board, not from legal. A number without a caller ID. The hospital director's face changed as soon as he answered. Yes, he said slowly. She's here. The room went quiet. Evelyn was asked to wait, then asked to move, then asked nothing at all. By the time a man in a plain suit arrived, no badge, no insignia, rumors were already spreading like static. He didn't introduce himself. He didn't need to. He asked Evelyn to describe exactly what she had done. Not in medical terms, but in situational ones. What she felt, what she noticed first, what told her the heart would respond. She spoke carefully. When she finished, the man nodded once. That technique, he said, was flagged in a classified after-action report 13 years ago. The room seemed to tilt. It was observed, he continued, twice. Both times in active combat zones, both times undocumented, both times performed by the same medic. He met her eyes. No accusation, no praise, just fact. The tone changed after that. No more talk of discipline. No more warnings, only quiet respect and unease. The Pentagon did not call to punish her. They called because they had been waiting. Waiting to see if anyone else would remember what the manuals forgot. Evelyn was offered a choice, not framed as an order, but everyone understood what it was. Share what she knew. Help codify the uncodifiable. Teach others how to recognize moments where the body could still be pulled back if someone was brave enough to try. She asked one question in return. Will this save people who don't wear uniforms? The answer came without hesitation. Yes. That was enough. Later, when asked why she had risked everything, Evelyn said only, some lives end because we're afraid to be wrong. Another time, to a group of trainees struggling with the idea of deviation, she told them, silence isn't obedience. Sometimes it's courage waiting to act. And once, quietly, almost to herself, she whispered, the body remembers things the books haven't learned yet. The hospital never announced what truly happened that night. But things changed. Protocols were amended. Research quietly funded. Training programs adjusted without explanation. Evelyn returned to work like nothing had happened. But sometimes, when emergencies escalated and everyone else froze, someone would look to her. And she would nod. Not loudly, not dramatically. Just enough. The patient she saved sent a letter months later. Handwritten. Trembling script. He never knew about the Pentagon, or classified reports, or techniques without names. He only wrote this. Thank you for not waiting. There are heroes who shout, and heroes who stand tall in silence. There are rules that protect us, and rules that must bend when humanity demands it. Some battles are fought without witnesses. Some victories never make headlines. But every now and then, a quiet act reminds the world that courage doesn't always ask permission. If this story moved you, tell me where you're watching from in the comments. Share what this story made you feel. And subscribe for more stories that honor the silent heroes among us, the ones whose hands remember what the world tries to forget. Because sometimes, the most powerful knowledge is the kind that was never written down.